Hello everyone, my name is Jacob Bryant and this is my presentation on sinus tachycardia. To begin, let's first talk about what is sinus tachycardia. Sinus tachycardia is a heart rate that is greater than 100 beats per minute that also still has a normal QRS and P wave morphology. The QRS is also narrow, being less than 0.12 seconds, with the PR interval being normal, being less than 0.24 seconds. Pediatric tachycardia, their rate is going to be higher. Their baseline is about 100 to 150 beats per minute, while for us, our normal is about 60 to 100. Therefore, the pediatric tachycardia rate is usually any rhythm above 150 beats per minute that, of course, still has a normal QRS and P wave morphology. Slide, I'm going to be discussing the mechanism of the rhythm, talking about how sinus tachycardia happens in the body. One main thing being your sympathetic nervous system or your fight or flight response due to the epinephrine intake to the body. You also have the systemic release of catecholamines that happens during hypovolemic situations. Sinus tachycardia occurs during this situation to help force circulation throughout the body due to decreased blood volume and pressure. Sinus tachycardia can also be your body's response to medication intake, along with your body's response to medication withdrawals. And sinus tachycardia is also a type of supraventricular tachycardia, which just means the impulse occurs above the ventricles. We discussed what sinus tachycardia is, along with how it happens. Now we're going to be discussing when it could happen, which in my opinion, there's so many causes of tachycardia, I think of it when it could not. Tachycardia is caused to many medical conditions, issues, and some of it is just the body's natural response. Some of the physiological responses to mental and physical stress can cause sinus tachycardia. Some things like your fight or flight response, your response to pain. You also can get sinus tachycardia as a response to exercise or strenuous activities. A good example for healthcare providers could be having your heart rate elevated after CPR. There's many other common causes of tachycardia, such as infection, sepsis, dehydration, hypovolemia, shock, and then going with medications. You take too much, or you just take a medication such as caffeine, your heart rate's going to be elevated, along with other medications such as albuterol, amphetamines, cocaine, and many others. You can also get sinus tachycardia due to withdrawals of medications such as alcohol, benzos, and opioids, and many others. You also can get sinus tachycardia due to having a high blood sugar or hyperglycemia, along with hyperthermia, and you can also get it from a sickness such as flu or COVID-19. If you have a fever, it's a very high chance that you will be tachycardic as well. We're going to be discussing the patient presentation of a patient with sinus tachycardia. Some common signs of sinus tachycardia is lightheadedness, weakness, a fluttering sensation in the chest, and fatigue. The patient's presentation would more depend on the underlying cause. It will be mainly presenting the cause of the tachycardia, less of the tachycardia. But to be able to determine sinus tach, you do need to do a 4-lead or a 12-lead to interpret the rhythm. To interpret sinus tachycardia from a different tachycardia, such as AFib or a flutter, you want to make sure that it is a regular rhythm, even if it is fast. They will have a short R to R wave interval. For it to be sinus tach, it has to be under 3 boxes, or like we said earlier, over 100 beats per minute. The P wave needs to be visible and regular, and there has to be no abnormal P waves or QRS complexes. So in this slide, we're going to be discussing how you would treat sinus tachycardia. The treatment is going to depend a lot more on the cause of the sinus tachycardia than it is the rhythm itself. Sinus tachycardia caused from exercise, physical or mental stress or anxiety. The best treatment plan would be just to try to calm and relax the patient, possibly change the environment if that's affecting the patient, whether it's hot outside or if they're in a crowded area. Now, the Sinus tachycardia is caused from dehydration, hypovolemia, or heat stroke. The best thing you can do is to give them fluids and do passive cooling. Try to get them into the back of the ambulance or into a cooler area. Now, if the sinus tachycardia occurs while they're at rest, acutely, or due to med intake or med withdrawals, the best thing to do is to do nothing. If you're able to keep the patient in sinus tachycardia without converting the rhythm, you should. If the patient's stable and you're able to just transport and monitor closely, that is, probably the best thing you do. Now, if the patient's unstable or, the rhythm's too fast that you are going to have to convert it, for a stable patient, you're going to want to do adenosine through a rapid IV push. If the patient is unstable, they look like they're in AMS and they might, turn into a cardiac arrest, the best thing to do is to do a synchronized cardioversion. So finally, I'm just going to be discussing some good things to know about sinus tachycardia. Sinus tachycardia is a normal rhythm. It's usually caused by stress or exertion of the body. It is normal for spontaneous resolution or for the heart rate to go back into a sinus rhythm. Tachycardia can be used more of a sign of other issues a patient might have if it is to happen at rest or combined with other symptoms. To definitively figure out the cause of sinus tachycardia, many tests must be done. Some and a lot of interventions might not be able to be done in the field and requires hospital intervention. Some tests are 24-hour cardiac observations, looking at arterial blood gas results, a chest x-ray, a D-dimer test, glucose and electrolyte results, and much more. Thank you guys for listening to this presentation, and y'all have a good day.